Hello everyone. In this video, we are going to study about a homeopathic medicine called Digitalis purpurea. Objectives. At the end of this session, we will be able to describe the drug picture of Digitalis purpurea, the guiding symptoms of Digitalis purpurea, and heart symptoms of Digitalis purpurea. Since Digitalis purpurea predominantly acts upon the heart and the heart symptoms are very much important, we'll give much importance to it and then to the other symptoms. The common name of Digitalis purpurea is foxglove, family Scrophulariaceae, prover Dr. Hahnemann. The parts used tincture from the leaves of the second year plant. So guys, when the Digitalis purpurea is in his second year of growth, we are going to take the leaves of it and then prepare a mother tincture out of it and use it as a medicine. Miasm, Sora and Psychosis, Diathesis scrofulus. So, these scrofulus diathesis people, thermally they are chilly patient. Digitalis purpurea is a chilly patient. Introduction. Digitalis, the word, it is divided into two words, digitus and purpurea. What do you mean by digits? Digits are like the fingers. You call the fingers as digits. So digitus means fingers. Purpurea in Latin is for the purple color. So purple color digits. You can look at the picture here. These are like the fingers, purple color digits. Okay. Tintinnabulum. It was believed that fairies resided inside the flowers of these plants. So, during the discovery, the ancient people used to believe, not the ancient, those the discoverers recently, they believe that the digits are in these digits. Inside these, the fairies used to reside. This was the belief. The entire plant is toxic. Roots, leaves and seeds will contain digitoxin, digitonin, digitalin and digoxin. So guys, these are the active principle of the Digitalis purpurea. These are toxin, digitoxin, digitonin, digitalin and digoxin. Digoxin was extracted and used as an anti-arrhythmic agent to increase the heart contractibility. So what does the digoxin do? It is going to increase the heart's contractibility. It was sometimes confused with symphytum. Now let us look at the constitution, the physical makeup of the Digitalis purpurea patient. They are light-haired persons. The child is fair complexion. You can look at the hair here. It is light hair, and then the child, it is very fair complexion children. There is cyanosis, that is the bluish discoloration, purplish bluish discoloration of the lips, tongue. You can see the lips and the tongue. There is cyanosis. Along with it, the eyelids and the nails also will have cyanosis. Digitalis purpurea, purple. So you can correlate it. Purple color lips and tongue, cyanosis. Sphere of action and pathogenesis. Where does Digitalis purpurea act, and after acting, what is it going to do in each particular organ? First, we'll read about the heart. In the heart, it is going to stimulate the 10th cranial nerve. It will produce irregular contraction. As a result, the pulse will become slow and the heart rate is also going to reduce. So guys, on the 10th cranial nerve, it will act and produce irregular contraction. Because of that, two things will reduce. The pulse will also become slow and heart rate. Pulse and heart rate will become slow. It also acts on the peripheral arteries. It produces contraction and increases the blood pressure. See, you can see here, it is increasing the contraction. As the contractions are increased, the blood pressure in the arteries will also going to be increased. AV node increases contractibility. Now let us see what does it do on the gastrointestinal tract. It will act on the mucous membrane of the stomach and the descending colon. So mucous membrane, the inner lining of the stomach and the descending colon, and it produces the systemic symptoms such as irritation, nausea, vomiting and diarrhea. Peculiarity of Digitalis purpurea is white ash colored stools. The stools are going to be white ash colored stools. Hope it is clear. The stools are white ash colored stools. It is acting on mucous membrane of stomach and descending colon. On the kidney, it produces edema, results in diuresis and suppression of urine. So guys, when is the edema occurring? When the sodium water content in a body is increasing, it produces edema, and there is increased secretion by the body, diuresis, and then suppression of urine also will be there. On the liver, portal congestion and jaundice. So, Digitalis purpurea on the liver, portal congestion and jaundice. In the male and the female genital organs, males, there is great weakness of genital organs. See guys, the genital organs in the males, there is a weakness in the genital organs. It may be the, the testicles, penis, or whatsoever. The females, there is muscle contractions of the uterus. The uterus, there is muscle contraction. Ailments from Digitalis purpurea's ailments from are alcohol, tobacco, sexual excess, and high living. These are the ailments: alcohol, tobacco, high living, sexual excess. Now let us look at the mentals of Digitalis purpurea. The music is unbearable to the patient. There are other drugs also in which music is unbearable. Sabina, Aconite, if you know more, you can put it in the comment box. And then very weak memory, very forgetful, thinking is difficult, cannot decide what to do. See the fish, what it is saying, I forget things almost instantly. The person, in the same way, you can imagine this to be a Digitalis purpurea patient. He's saying that he forgets the things very easily. There is weak memory, very forgetful. The thinking is also very difficult in them. The person cannot decide what to do. There is anxiety with a great dread for future. The person fears of his future. He is very much worried about his future. There is evil forebodings and apprehensions. The person is low spirited, despondency, that senses are dull. The patient feels that his senses are dull. Raving excitement alternating with melancholy. This was said by Borninghausen. So guys, there is a raving excitement. The person is like very happy and joyous the one moment, and the next moment, other moment, is going to become all sad and gloomy, melancholic. You can look at in the picture here. The person is becoming all sad in the very next moment. Frightening dreams of falling. The person dreams that he is falling from heights. Frightening. They are very scary to him. In his dreams, he is very scared and he is dreaming as if he is falling. Other mental symptoms are like the Digitalis purpurea patient wants to be alone when tired, lascivious fancies day and night. High living, lascivious fancies will be there. Particular symptoms. So it acts upon the eyes, nervous system, skin, teeth, heart, lungs, respiratory, liver, kidney, and then the gastrointestinal system. Now let us go in detail about each symptom. First we'll see in the heart. What are the ailments for the heart? Again it's the same: alcohol, tobacco, sexual excess, and high living. The sensation, he feels palpitation even with the slightest movement. Heart would stop beating. So guys, see, there are two drugs here. One is Digitalis purpurea and the other one is Gelsemium. In Digitalis purpurea, the patient feels that the heart will stop beating if he start moving. He wants to remain in a place. If he move, his heart is going to stop beating. The opposite is in Gelsemium. Gelsemium feels that if he is sleeping, if he is like here, if the motion is going to stop the heart, there if he sleeps, he feels he's going to his heart is going to stop. Here motion is going to aggravate the problem, there the motion is going to ameliorate the problem. Character: pulse, slow irregular pulse, It begins later, fast as lightning. So guys, first it will be irregular pulse. It will be slow. Later on it becomes fast like lightning. So fast the pulse is going to be. It intermits between the third, fifth and seventh beat. So you can hear the pulse in the third beat, fifth beat, seventh beat. In between it is going to skip. Intermits in the third, fifth and seventh beat. Like I told you, slightest motion, they are dread of motion. Digitalis purpurea very scared of motions. The slightest motions, there will be palpitations. Now let us see the concomitants along with the heart complaints, what all the person is going to face. There is a sinking sensation as if life would go extinct. So badly there is going to be a sinking sensation in the stomach that the person says that feels that this is going to be the end of it for him. Extreme prostration. The face is cyanosed, difficult respiration with sighing, and the fear of suffocation during sleep. So the person was sleeping, now he has fear of suffocation during the sleep. And the respiration, look at this person, how is he sighing? There is difficult respiration and a great sighing in Digitalis purpurea. These are the concomitants. 3 concomitants: sinking sensation in the stomach, extreme prostration, face will be cyanosed, respiration is difficult, and suffocation during sleep. Now let us see the gastrointestinal tract. There is loss of appetite but violent thirst. The person doesn't want food but he is very thirsty. Very thirsty. There is violent thirst. Deathly nausea remains after vomiting. Nausea is the sensation. The vomiting sensation before getting the vomiting is nausea. Even after the person vomits, the nausea is going to continue in him. There is deathly nausea. It is going to remain after vomiting. Sinking sensation in the epigastrium. As we read in the concomitants of the heart, there is going to be sinking sensation in the epigastrium. The stools, white ash, we read earlier, it is chalky, ashy, pasty stools. You can look at this here, the stool, ash colored, chalky. Then burning pain is extending to the esophagus. From the stomach, the burning pain is going to extend into the esophagus. Urinary symptoms, there is frequent urging to pass urine, dropsy with suppressed urine. So guys, we read there is suppression of urine, same here. There is dropsy with the suppressed urine, with the sharp cutting or throbbing pain at the neck of the bladder, as if a straw was being thrust back and forth. You are inserting and removing it out, inserting and removing out. What? The straw in the neck of the bladder. You should imagine a urinary bladder. In the neck of the bladder, the straw is being inserted and being forth, back and forth, it is being thrusted. This is what the sensation will be there on Digitalis purpurea patient. Brick dust sediment. So in the urine, it is going to be red color, brick dust sediment. Sensation of fullness after micturition. The person feels full after micturition. Now let us go to the abdomen. The liver is enlarged, pain at the region of the liver, jaundice with the pale ashy stools, jaundice with a slow pulse. You can see jaundice, icterus, there is liver is enlarged and there are ashy stools. Male genital organs, there is great weakness and prostration of genital organs. The hydrocele, scrotum is enlarged like a bladder. So guys, hydrocele is nothing but dropsy, edema in the scrotum is known as hydrocele, and along with it the bladder is also going to be enlarged. The gonorrhea is chronic with edema of prepuce. So along with the edema of the scrotum, there is also edema of the prepuce of the penis. There is enlarged prostate. The prostate is also enlarged. These are the male genital organ symptoms. Now let us see the female genital organs. Labor-like pains in abdomen and back before menses. There is uterine hemorrhage. You can see the woman, she is having labor-like pain in the abdomen that is occurring before the menses. Along with it, there are uterine hemorrhages. In the head, there is vertigo on walking and on rising. The frontal headache, sharp shooting extending to nose. See, the frontal headache is extending up to her nose. After drinking cold water or ice cream. When is she getting the headache? After there is intake of cold, that is water or ice cream. The face is bluish. There is blue tongue and lips. Like we saw there was cyanosis of the lips and the tongue. Same thing, face bluish, blue tongue and lips. Eyes, blepharitis. Lids margins are red, swollen, agglutinated in the morning. You can see here the lids, the margins of the lids, they are red, they are swollen, they are agglutinated. You can see the agglutination here. Blueness of the eyelids, mydriasis, diplopia. These are all the conditions which are seen in the eyes. It can be treated by Digitalis purpurea. Respiratory symptoms, dyspnea, cannot desire to take deep breath. So there is difficulty in the breathing. The person cannot take deep breaths. Breathing is difficult with the deep sighing. We saw in the picture of like the respiratory system pathogenesis. The person was deeply sighing. Cannot bear to talk. Hemoptysis with a weak heart. So guys, hemoptysis, the sputum is going to contain blood and the person is having a weak heart. Okay. Extremities, swelling of the feet, coldness of hands and feet, rheumatic pain in the joints, shining, white swelling of joints, sensation as if red hot wire suddenly darted through the legs. So guys, there are peculiar sensations here in extremities, as if, like we read in the urinary bladder, the kidney symptoms, as if a straw was thrust forth and back into the neck of the bladder. Here it's like red hot wire suddenly darted through the legs. So in the legs, as if a red hot wire is darted through the legs is what the sensation the person is going to feel. Along with that, in the rheumatic pains, and there is swelling and coldness of the hands and the feet. Sleep, we already read, wakes up started from sleep as if he is falling from a height. The person feels as if he was falling from a height, he wakes up started. Skin, erythema, deep red, worst on the back and like measles. So you can see the erythema here, redness, it is deep red and it is on the worst on the back. Jaundice skin and itching, dropsical swellings, we read there is swelling everywhere, the extremities, the scrotum, the bladder, everything. Now let us look at the guiding symptoms of Digitalis purpurea. Heart, like it would be a revision for you guys, the guiding symptoms. Since we have read the particulars in detail, it will be very quick and easy now. Heart sensation as if the heart would stop beating if he moved. So aversion to motion, slow, weak, irregular, intermittent pulse. We read when is the pulse heard? Third, fifth and seventh beat. GIT, systemic symptoms, as I told you, nausea, vomiting from the smell of the food. Nausea is not relieved by vomiting. Pale, white, chalky, ash colored stools. There is clean tongue, loss of appetite, but there is violent, strong thirst. The person doesn't want food but wants a lot of water. There is violent thirst. The skin, blue skin with cyanosis of lips, face and eyelids. The edema with the suppression of urine and cardiac debility. Respiratory system, difficult respiration, has to gasp for breath. Prostration from slight exertion. Urinary symptom, involuntary wetting bed at night. So the person, there is involuntary wetting in the bed. So he passes the urine involuntary. Abdomen, the liver is enlarged, feels sore to touch, jaundice. There is great weakness and sinking sensation in the epigastrium. Now let us look at the mentals. There is anxiety, music is unbearable, the person is very much forgetful. The motion is like going to aggravate most of the complaints. Especially the heart. The person feels that his heart is going to cease if he starts moving. Dr. John Henry Clark has told that there is slow, weak, irregular, intermittent pulse. There is enlarged, sore, painful liver. The pale, chalky, ashy, pasty stools are the characteristics of Digitalis purpurea. Let us look at the general modalities. Aggravation, guys, motion, talking, sitting erect during sleep, excitement. Amelioration when the stomach is empty, in open air, pressure, frequent micturition. Okay, amelioration again, it's very new now. Amelioration, stomach is empty, open air, pressure, frequent micturition. Now let us make a comparison here. Palpitation from the least motion, it is in simic and digitalis. Palpitation from least mental exertion. See, this is bodily exertion, like motion is bodily movement. It is which will lead to palpitation. It is in simic and digitalis. From the least mental exertion, if the person does some mental exertion, that is he uses his brain to study or perform any job or something, then it is calcarea ars. Fears unless on the move, heart would cease beating. So guys, this symptom, like this comparison I have already told you, digitalis and gelsemium, here it is clearly told he fears heart would stop beating if he moved. So aggravation from motion, if he moves his heart is going to stop. This is what the digitalis patient says. Here the gelsemium patient he fears that unless on the move, heart would cease beating, which means if he comes to rest, the heart will cease beating. He wants to be always moving. Pulse irregular and slow in digitalis, calm and virat. The trios of heart remedies are digitalis, cactus and spig. Hope the comparison is clear. Now clinicals, when all can digitalis purpurea be used? Angina pectoris, asthma, Bright's disease, cyanosis, diarrhea, dropsy, enlarged prostate, gonorrhea, heart affections, lung troubles. A big thank you for everyone for your patient listening. Hope you like the video. If you like it, hit the like button, subscribe to my channel and comment in the section below whichever remedy you want me to explain in the next video. Thank you guys.